And if you don't know about biological dentistry, this is your chance because we're bringing on an amazing biological dentist. We are so excited to bring her up here. Let me tell you a little bit more about her. Dr. Maya Assi is a certified biological dentist at Alpha Dental Practice and Implant Center who connects oral health with overall well-being. A Nova Southeastern graduate, she is certified in ozone therapy, Invisalign, DSD, and BioClear. Who here knows about biological dentistry? Okay, you have some work to do, Dr. Maya.
Yeah.
Please put your hands together for Dr. Maya.
Thank you so much. So a few years ago, about 10 years ago now, one of my friends who I grew up with back home, who also happened to be one of my patients, called me. And he said, you know, Maya, you heard I have lymphoma. And I said, yeah, how's it going? He said, well, out of all of the places that lit up on my PET scan, an old root canal tooth lit up. What do you make of that? At the time, I said, studies haven't proven anything. I wouldn't really give it any thought. Just go on with your treatment. Less than a year after that, a patient who was originally very nervous in the chair, we became friends, and she says, Maya, you know, I feel something really weird here. It's not pain, it's not discomfort, but when I take my finger and run it under my nose, I feel something strange. I said, okay, so let's take a look at it. She had had trauma to teeth at an early age, so the teeth were capped, and they were actually dead teeth. Ended up that those teeth had root canals. She still felt the pain. A root canal specialist retreated the root canal. She still felt the discomfort. And so I told the root canal specialist at the time, I said, she still feels it. And he said, it's all in her head. There's nothing more that I can do for her. Tell her it's in her head and she'll be fine. The x-rays don't show anything. So at that time, I had a decision that I had to make. I could tell her that it was in her head, or I could pursue it further. So at that time, I brought in another root canal specialist, and he says, I don't see anything, but we can go in and do an apical. That's where you open it at the tip. Let's do an apical and see if that helps her. So he is a very tan guy. He comes to my office after he opens her up, and he says, something's not right. I said, what is it? He said, it looks like papaya seeds up there, all the way up to her nose. I said, well, let's biopsy. So we biopsied it, and we sent it actually to University of Florida. And after a few weeks, the results came back, and it was fine. It was granulation tissue. So I printed out a copy of the results. I gave her the results, and I said, you're going to be okay. Everything is fine. The next day, they called me from the lab, and they said, don't tell the patient the results. I said, I already told the patient the results. They said, well, we decided to retest the slides, and your patient has B-cell lymphoma. So I had to bring her back, give her a new copy of the results. She ended up at University of Miami, and a few weeks later, the oncologist down there called the office. He said, I need to speak to this dentist. So he gets on the phone with me, and he said, we did a scan on your patient, and the only place that she has B-cell lymphoma is at that tooth. And the incidence of us finding B-cell lymphoma at that tooth is 0.02% chance. So tell me how you found it. So I went over my clinical notes, and I shared everything with him. But I said, at the end of the day, it's because I listened to my patient. It's because I refused to tell her it was in her head. And that sparked a new journey for me. I started reading the research for the first time since dental school. I started reading the research on the other side. I wanted to know about my patients asking about fluoride. I wanted to know about my patients asking about root canals. And today, you know, I dug into all of the biological associations that I could. I've read the research. I continue to read the research as it comes out. And I stand in front of you, a biological dentist today, a completely different paradigm. My name is Dr. Maya Assi, and I really just follow a philosophy of care that strives to provide non-toxic modern dentistry with the least toxic materials possible to affect our patient's biological terrain as least as possible, constantly making the mouth-body connections. I want to thank God for always blessing me so that I can be a blessing to others, blessing me with the most beautiful family, supportive husband. And if you guys don't know this team, this is the best team in the world. They actually had to unlearn traditional dentistry and relearn the new form of dentistry with me, and they did it, and they continue to do it every day while we provide care for our patients, and for that, I am ever, ever grateful. Let's leave the mouth to the side for a minute, and let's just understand that life is energy and vibration. Through a series of muscle stacks that we call electroacupuncture points, energy flows through the body to certain organ systems, and in order for this flow to happen, we have to be devoid of toxins. The voltage actually has to be able to get there, and we have to provide our bodies proper nutrition in order for that to happen. The other thing I want to bring up is the yin and yang of life, the balance between the sympathetic and parasympathetic. Right now, we are in a world where we are in sympathetic overdrive. And if you have a hidden chronic infection or an issue in one of the most vital areas in your body, no matter what you do, you will, low level, always be in sympathetic overdrive. This is the area, ladies and gentlemen, that I have the privilege of taking care of. All of our cranial nerves, did you know that the fifth cranial nerve takes up more than 50% of this space? That through retrograde axonal transport, teeth are little organs, and anything you do to them can go backwards. Why is it that this is the area that is most burdened by heavy metals and toxic materials and chronic silent infections caused by us in the whole body? Why is not enough people talking about this? Let's talk about some of the toxins that I think you should be able to take away with today. And the first one is fluoride. Thanks to the support of many people, we were able to get fluoride out of the water in Florida, and hopefully the rest of the states will be able to follow. But fluoride comes from fluorine. It's a halogen. It's the most reactive halogen. So what it does is it displaces and replaces things very quickly. Displaces calcium, replaces iodine, interferes with enzymatic activity. So when you're brushing your teeth with it, it's getting absorbed through your buccal mucosa. This is a developmental neurotoxin. This is not debated. This is the truth. So why are we using a developmental neurotoxin in the name of preventing cavities? And as far as it being in the water, when my son, let's say he's 5, drinks a glass of tap water, and I, who am an adult, drink a glass of tap water, we're getting a different effect because we're in different stages of our development. Putting this in our water, and thankfully, we don't have to worry about this in Florida anymore, but other states do, and I know some of you have traveled to get here. This is taking away our informed consent medically. This is medicating with a neurotoxin in the name of preventing dental decay, and this is not okay. I was very blessed to be introduced into the fight to remove fluoride, actually, from Miss Layla Sentner over there introduced me to the people who were putting up a good fight, and I was there side by side with Joseph Ladapo. I was in front of the commissioners, and I was so happy the day that we announced that fluoride was out of the drinking water in Florida, and I really hope that states will follow. The next toxin I want to talk to you about is mercury. So they call these amalgam fillings, but these are mercury. These are made out of elemental mercury. Elemental mercury vaporizes at room temperature. And so what this means is every time you brush your teeth, grind your teeth, drink hot tea, you're getting a little bit of mercury vapor released every single time. And most of us have had these since we were 6. That's the main thing patients say. I've had this since I was 8 years old. So what has happened to your biology every single year since you've had these in your body? This is a smoking tooth video. This is actually a 25-year-old tooth that had a mercury in it for 25 years. They scratched it with the back of an eraser. Can you see the vapors coming out of that? That was placed 25 years prior. You can see the mercury vapors coming off of that tooth. You see that? That's happening to your biology every single day. And so what does the FDA say about it? They say, yes, we acknowledge that's true. A little bit of mercury vapor does go off of these fillings every single day. However, we don't deem these levels large enough to cause any harm. So I'm going to ask you a question. I'm going to give you a little bit of arsenic every day, very little. Are you going to be okay with that, even though you're not going to feel the effects till you develop dementia? So it is my opinion that most dental professionals are also mercury toxic. Do you know how they talk about high levels of depression and suicide among dentists? We should test the mercury levels there, because a lot of us were not taught to remove mercury safely. And so, now the way that we remove them is by using something called SMART. How many people have heard of this technique? Safe mercury amalgam removal technique. What we do is, guys, as if coming to the dentist wasn't bad enough, this is what you look like when we do it. We cover you from head to toe. But the purpose is to prevent your biology from being exposed to any of the dangerous mercury while we're removing it. This is actually the only thing showing are the teeth that we're working on. And we go in and purposely chunk these out in chunks so that we create very little vapor while we're removing them. This is a patient who is having them removed. You see the oxygen is in the nose. Everything is covered up. We use 3 suctions at the same time. We use air filtration, surgical air filtration, and that's how we safely remove it. If this filling, I take it and I throw it down the drain, I get an EPA violation for that. So how can I how is it legal for me to let you swallow it when I'm drilling it out? It's not okay. The other thing to look for is metals, because these metals are heavy metals. There's cadmium, nickel, chromium, all mixed together and sometimes covered on the outside by porcelain. So everything looks good, but what happens is something similar to corrosion. Saliva is an aqueous solution, which is an electric conductor, and we can see corrosion when we remove these restorations. And even worse, in some people, something called oral galvanism, where you get your little electric current. You have a gold restoration here, you have a mercury restoration here, you have something that looks white on the outside, but it's metal with nickel on the inside, and now all of a sudden you have an electric current inside your head. It makes me think of the patient who flew to me from somewhere else, having chronic headaches that no neurologist in the world could figure out. And once we removed all the metals, the headaches went away. I can't make this up. But when we choose to replace these, we want to do it as biomimetically as possible. We want to remove as little tooth structure as possible. We want to try to reconstruct the tooth so that the inside flexes similar to the inside of the tooth, and the outside flexes similar to the outside of the tooth. So we tend to try to replace these whenever we can with ceramic inlays and onlays. We don't want to solve a problem by creating another problem. We try to avoid crowns when we can, because we want to take that drill to the tooth as little as possible. Anytime we drill on a tooth, unfortunately, it starts the death spiral of the tooth. And so stopping, slowing down, picking the proper materials is very, very important. Let's talk about what I call interferences, or neuromodulative triggers, so silent, chronic interferences on those pathways that we can find. And the first one I want to talk about is chronically infected root canals. A lot of times there's no pain associated with them. Root canals are the standard of care for taking a patient out of pain. A patient develops pain, and the nerve of the tooth is removed. The good people who do the root canals go in and they clean as best as they can and they stuff them up. They get the patient out of pain, but what happens is the nerve tissue can never fully be cleaned because it's such an intricate system inside of there. So there's nerve tissue or organic tissue that remains. The second thing is the root surface is very porous. So as bacteria can re-infiltrate through the pores of the tooth, our immune system that knows that there's an infection there tries to attack, but our macrophages are large. They can't infiltrate inside the tubules, so it becomes a cat and mouse thing, where the bacteria is inside the hole, that's the mouse, and the macrophages are the cat trying to get to the infection, but they can't. So we form these cavitations, these infections on the tips of the root. And remember, everything's connected, so every time you chew, this is going all over the body. It's not just a mouth thing. Also, the bacteria that resides in these chronic infections spew out endotoxins, highly toxic, potentially carcinogenic, hydrogen sulfide compounds, thioethers, mercaptanes, and this is being spread out through your entire body. This is an interference. So the question I get is, does everybody that walks into your practice get all root canal teeth automatically extracted? No, but let's check them. Some people, their body will be able to handle it. Some people, their body won't be able to handle it. And why don't we individualize care from person to person instead of blanketing everybody and treating them the same? I got this from my body, Dr. Kelly Blodgett. This is what they look like most of the time. These two roots are extracted, chronically infected root canal teeth. It's gangrene sitting in your jaw. How is that not affecting the rest of your body? It is. I've gotten a lot of arrows on my back for fluoride and for this topic specifically, but I think people have the right to know. You have the right to know when you're making that decision that it may affect the rest of your body. Some studies show up to 70%, okay? Next interference is something called a jawbone cavitation. Anybody familiar with this term? Anybody hear about a cavitation? My mom? Okay, good mom. So anywhere a tooth could have been extracted, and we see these a lot where wisdom teeth were extracted. There's a possibility that the bone may not fully heal. And when it heals on the outside but doesn't heal on the inside, it's a persistent wound. So the body is like, oh my God, there's something going on there. So your C-reactive proteins go up, a specific chemokine called RANTES, CCL5, very, very high. And so instead of optimizing, like we're all trying to do, your body is busy fighting this. And most of the time, there's no pain associated with a cavitation. And traditional dentists, who I was before, we're not trained to even look for these. So we screen for these through 3D, cone beam. And if we find them, we decide whether or not the patient is a candidate to have those surgically cleaned out. But this is something big, and on the topic of wisdom teeth extractions, they're way overdone. They shouldn't be routine, you're 16, let's take them out. I say get a second and third opinion on it. Sometimes they do need to come out. But if they do come out, what is the surgeon gonna do to take them out, and how are we prepping the body? Most of us, we're 16, 17, our bodies are in hibernation, we're eating over-processed foods, we're not sleeping, we're getting this major surgery done. How are we gonna heal? Is there PRF used in the surgery? Is there ozone? What are we doing to try to prevent these cavitations from forming? This is what it looks like most of the time when we open up the bone, and that's why it's called fatty degenerative osteonecrosis of the jawbone. It's bone that never healed. If you do decide to have, for example, that root canal tooth, imagine it needs to come out. How are you going to replace it? Are you going to place a titanium implant? This is another hot topic. Did you guys know that there's an alternative option to titanium implants? Ceramic implants instead? Titanium in a lot of people creates a hypersensitivity. It's not an allergic reaction, it's a hypersensitivity. As soon as the titanium drill goes in, titanium oxidates are released into the biology, and that stimulates, once again, your body's immune system is like, something's not right. Dr. von Baer out of Germany actually did a couple of studies and figured out that there are 4 main genetic constellations, genetic makeups. And if you are the 4th genetic constellations, you are what he calls a high responder. Those are the patients that will have a seriously bad time with a titanium implant. Fatigue all of a sudden, headaches all of a sudden, the implant doesn't heal, it's chronically, and they call it peri-implantitis, and they'll tell you you didn't brush your teeth well enough, or you didn't come to your every 3-month visit, but this is your body reacting to the titanium. This is biology. Studies have shown tribocorrosion, corrosion that happens from the minute the implant is placed to the implant restoration to the maintenance phase, especially if you're using fluoride. And why most people are highly sensitive to titanium these days is because of this. Titanium dioxide, E171, banned in a lot of products, other places, which we have readily available here. This is what makes things white, chewing gum white, toothpaste white, or creams that we slather all over our body. So we are, especially a certain population of the women population, highly, highly sensitive to titanium. Because of this, we've been sensitized to this for years. The other thing is the antenna effect. So studies now show that in the EMF world and the 5G that we're living in, when you take your cell phone and you put it up against your ear and you have a titanium implant, it's actually increasing the temperature of the bone and surrounding tissues by 4 degrees Celsius. Do you want to be an antenna? Do you have the option not to be? You have the option to place a ceramic implant instead. Ceramic implants, now studies show, and your dentist might tell you they break, they're not as good. That's old information. This is updated information. They work, and they're just as good as an alternative to titanium implants. And actually, when they heal better. They heal with a zirconia epithelial connection. So you guys have heard of leaky gut? That's where things get into your bloodstream that are not supposed to get into your bloodstream. There is such thing as leaky gum. So when you have a titanium implant and it doesn't form a perfect seal on the gums, which no titanium implant does, it's actually a hemidesmosomal connection instead, you're having leaky gums. Stuff is getting into your body that shouldn't be getting into your body, but with a ceramic implant, actually forms a ceramic epithelial connection, no more leaky gum. And the way that these heal are just amazing. They're neutral in the body. The temperature doesn't go up, and they don't form a hypersensitivity. This is what they look like. Wouldn't you, I mean, just for a cosmetic standpoint, wouldn't you rather something white sticking out of your gum instead of something black? But we're here because we are all interested in biology. And it makes sense to us that we want to affect the biological terrain as least as possible. This is a patient, Ashley, who went from dentist to dentist because ever since she had her root canals done, she never felt well, and she developed a rash on her face, and everybody told her no. Everybody took x-rays, and they said, no, we're not taking them, you're crazy. That would be below the standard of care. This is another patient, congenitally missing lateral. She had nothing wrong with her teeth, are pristine, not even one cavity. We're gonna put a titanium implant in there. We're gonna use a ceramic implant in there. Look how beautiful. That's the day we placed it. The second picture in the middle, we placed it, we temporized it. That big picture over there, that's the end. That's how we ended. We use a lot of PRF in our surgeries, which I'll get into a little bit later. That's our requirement. We will not do a surgery without PRF. For those of you who know PRF, we spin your blood, concentrate it, and put it back in. And we do a lot of photobiomodulation with, this is a erbium YAG laser to help speed up healing. decrease inflammation and swelling, and decrease pain. This is the same day we remove those teeth, we place the ceramic implants, and she's got temps on there. That's all the same day. That's how clean and neat the surgery looks like. This is her 1 week post-op. The temps are the 2 teeth on that side. This is 4-month post-op. This is what they look like at 4 months, healthy. On top of the fact that her rash disappeared within a week of her having the surgery, and all of those weird symptoms that she was having were gone. And the teeth that we extracted, we actually did a DNA connections test. I'll show you the results a little bit later, and I'll tell you what that is. These are her finals. Beautiful, she's happy, she's healthy. Another thing I want to talk to you about is, I spoke to some people at the booth about this, is Dr. Felix Liao says that some people are 6-foot tigers trapped inside 4-foot cages. What does that mean? It means that your body isn't structurally fit to support the rest of your body. You're collapsed. The person who snores all night long, or the kid that mouth breathes all night long, they're not getting proper oxygenation, they're not getting proper formation, their tongue is in the wrong position. This is something we need to look at. And dentists should be the first line of defense, because we stare down that mouth all day long. We should be able to screen whether or not we think patient has a potential sleep apnea situation. And if your partner is snoring or stopping to breathe and snoring again, get them checked out, because this is the person in their 50s, in their 60s, who has a stroke out of the blue, and nobody could figure out why. No nitric oxide is getting delivered down there. No recovery is happening down there. This is critical. We also focus on the microbiome. And so as part of our comprehensive test, we will look at our patient's microbiome and see where the dysbiosis is. What's causing the bad breath? If all dentists are telling you to brush your tongue or scrape your tongue, but your bad breath is coming from your gum liners, that's not going to help. Where is the dysbiosis? What can we do about it? How can we be intentional about how we treat our patients? And it never, ever, ever should be, and it never will be, for me, one size fits all. So on the topic of the microbiome, people say, well, what do you recommend? I'm going to cater your treatment to you, but generally, I love coconut oil pulling. It's also an exercise, like the kids say, mewing. Tongue scraping with copper tongue scraper or stainless steel. Part of my hobby is to explore different toothpaste, which one has lead, which one doesn't have lead in it. Right now, we really like Fig, Feed Your Good Guys, hydroxyapatite. So something that remineralizes your teeth without the toxicity that fluoride has. Natural floss, we love cocoa floss, oral probiotics. Guys, no more, anybody still use mouthwash? No more mouthwash. Why? Because it disrupts the microbiome. The back of the tongue houses nitrate-reducing bacteria. This bacteria actually is responsible for producing nitric oxide and delivering it to the body. The other place is when you breathe through your nose. When you breathe through your nose, mixes with the maxillary sinus, the lining there, and nitric oxide is made. So if you're a mouth breather, or if you're using, I'm not going to say the name of that, but you guys know the name of that, toilet bowl cleaner rinse, you have a higher risk of cardiac issues just because you've been using this risk forever, because that's what they told you to do. High risk of hypertension and heart problems with this risk. So stop it right now and let's do some probiotics instead. Some of the tests that we run. Biocomp Labs is one of the tests that we run. So if you have a lot of work that you need to have done, this is something you should consider. If you're gluten intolerant and you eat gluten, you're going to have a bad couple of days, but the insult will leave your body and you'll be okay. What if you were intolerant to a material that was put in your body as a permanent fixture? What happens then? Your body, you won't experience pain, some people do, but you're going to be fighting this. Your body is like, this is not for me, this is not for me. That sensitivity that won't go away, maybe the bonding agent wasn't right for you. So if you have extensive work that needs to be done, this is a test that we run. It's a serum biocompatibility test, which tests people's biology against any and all dental materials out there. So we know what to use on you. Of course, as a standard, we use BPA-free products, and we don't like to use plastics. But if you have a lot of work that needs to be done, test your biology. Let your dentist use what's compatible for you. This is the test that we mentioned earlier. This is called the DNA connections test. This is Ashley's test. Those are the 2 teeth that people refuse to take out for her. These teeth, whenever we remove a chronically infected root canal tooth, we send it to a lab. And the lab is called DNA connections. They split open this tooth, and they take a sample from inside, a PCR evaluation of everything that was living inside. Remember, this is supposed to be a sterile environment. She had more than 22 pathogens living inside those teeth. That's why she felt better after that was removed. She even had some parasites. And it's not unusual for us to see parasites. Actually, out of all of the DNA connections tests that I've done, it's only once that I didn't find a parasite. Okay? So, also very critical to know your vitamin D levels and your LDL levels, especially if you're going to have dental surgery in any way, and even more important, if you're going to have an implant. Vitamin D levels, you know, if you've ever had an implant done, your dentist will tell you don't smoke, it'll ruin the implant. The vitamin D levels are actually much more critical than smoking. I'm not telling everybody to smoke, but I'm just saying looking at your vitamin D levels is very critical. And here in the United States, they tell you that your levels should be between 30 to 60 nanograms per millimole. We like them to be optimal. This is an optimal group of biohackers, so we want them to be between 70 to 80 nanograms per millimole. You'd be surprised how many people are deficient in vitamin D, even though we live in Florida. So we supplement our patients with vitamin D prior to their surgery. We will not do surgery on a patient who's deficient in vitamin D because we know what that does. LDL levels are a reflection of how a patient will heal. Now, I'm not promoting any type of cholesterol medication in any way. But I'm saying knowing your LDL levels will be a proper reflection of how you will heal from your surgery. And anything above 129 is a risk, okay? We use ozone a lot. I think this group is very familiar with ozone, but for whoever isn't, ozone, when you electrify oxygen, the O2 splits and it reconnects. When it reconnects, a third oxygen atom connects to it. But that third oxygen atom is very unstable. It wants to detach and attack anything that doesn't have an antioxidant cell wall. What doesn't have an antioxidant cell wall? Bacteria, fungus, virus, mold. So ozone is the natural, safe, anti-pathogenic that we use in the practice. Very safe. We use it topically. Centers like Layla Center uses it systemically. The benefits of ozone, they don't want you to know about. But this cures, and this heals, and this helps to promote health. So we use ozone in all of our surgeries. We use it in our periodontal treatments. We use it to stop incipient decay, so cavities that are just starting. My goal is to never take that drill to a tooth if I have to. Sometimes I do. But if they're small enough that we can try to reverse them, the body's amazing, we can. And if we can't reverse them, we're going to use a laser to cut the teeth instead of a drill when we can. This is us doing an ozone insufflation on an incipient lesion, young girl. We did not want to take, of course, a lot of nutritional counseling because you can't have this and then continue to eat junk and expect that the cavity is going to arrest. PRF we use with all of our surgeries, and a biological surgery should look like this. Your blood is being drawn, it's being spinned in a centrifuge. We're either forming membranes or clots with your own blood. We're using 3D imaging to know exactly where to go and what we're dealing with. We're cleaning the socket and debriding the periodontal ligament. We're using ozone, and we're very blessed to be able to use a laser This is what the PRF membrane looks like. It's from you to you. So it takes your body 10 days to get those healing factors to the site of surgery. So when you're doing it the day of surgery, you're actually biohacking your body to heal 10 times faster than it normally would. Rapid healing, cytokines, or anti-inflammation. I mean, I can't tell you the benefits of PRF to the point that we won't do a surgery without it. The laser, this is us doing something called ozone sweeps in a cavitation to decontaminate. Sorry, I should have been like warning some of these pictures might bother you. This is very new, the use of exosomes. We are now using exosomes with our surgeries. Exosomes, very interesting enough, used to be considered extracellular waste not so long ago, and then they discovered that on top of stem cells, the exosomes are also responsible for signaling healing. Every exosome, it's like a little bleb, but it contains RNA, DNA, proteins, it mixes with the cell wall and actually helps cell-to-cell communication. Osteogenesis reduces inflammation, cell migration. Amazing. We just started using exosomes, and we are actually documenting the difference between surgery with exosome, surgery without exosome. And just on Thursday, I think I saw a post-op for one of our patients. I was blown away. So look for this word in the future of dentistry. You're going to hear it more and more in biological dentistry. Nutrition is so important. Cavities are not a fluoride deficiency, they are a reflection of a metabolic disease, mouth breathing. All of our patients, especially if they're going to undergo surgery with us, will get nutritional counseling. Remember, that's one of the first things, if you were here at an earlier talk when Layla spoke, that's one of the first things they did to miraculously prolong and save a cancer patient's life, is stop eating the wrong stuff. So for us, we follow something called the bone healing protocol. My buddy, Dr. Dominik Nischwitz, is a biological dentist out of Germany, and we follow his protocol. So our patients go gluten-free, sugar-free, dairy-free, and vegetable oil-free. They're eating to their protein level that they need to eat at. They're eating clean, and they're supplementing. So, you know, it's very important. A lot of times we are deficient in minerals. Tooth Shield, you may have seen it on the booth, but this is magnesium, zinc, D3, K2. Remember, the K2 takes the calcium where it needs to go. It's very important. And boron, the missing link. Everything pre-methylated, everything chelated is very important. This is my oral routine. This is like I finish doing my brushing and my flossing, and I take a Tooth Shield. This should be part of our oral routine, making sure that we have the right minerals in place for our teeth. We use a lot of homeopathics in our office. This is one of the companies that we really like. It's not medicine, it's homeopathic, and it's gonna help to heal, decrease pain after surgery. Again, rinses, we're using them short term, not long term. We don't wanna mess with that microbiome. And of course, we love to use stacks. So a lot of our patients that undergo major surgery are going through the hyperbaric chamber prior to. We're delivering oxygen to their cell tissues. We partner with a facility in Fort Lauderdale, and soon we'll have one in our center. We do vitamin IVs. Perioperatively, you want your body to be flooded with at least 45 grams of vitamin C. We're big on the vitamin C IVs because that helps to build collagen, decrease infection of risk of infection, and help to heal in general. So our patients are getting the vitamin C IVs day before, day of, day after, through IV for better absorption. Lymphatic drainage, red light, infrared light to help heal after. Guys, my point of being here is just to tell you that the mouth is connected to the rest of the body. The days of just being architects of the mouth, that's over. That should be over with. It was over for me 10 years ago. It should be over for you guys too. Let's connect the mouth to the rest of the body, and let's make sure that we remove the interferences in order to optimize health. I am so grateful for your time today. Thank you so much for your attention. We are downstairs if you have any additional questions.